When should you be presenting cases in dentistry? Well, there's a formula that you need to follow. This is Dr. Allen. If this is the first time you're reaching my channel, I am a dental management consultant helping doctors develop, scale, and exit from their businesses successfully. Today, I want to discuss with you about case presentation techniques. This is the third part of your sales communication cycle after you have actually contacted the patient well, you have done your clinical discovery, you've asked great questions, a very thorough examination. Now it comes to presenting your case to a patient. Now, where you do your presentation is very important. It has to be in a room that is absolutely organized, is clutter-free, and it doesn't feel like it's confining the patient, okay? Not one of those choky rooms or anything like that. It has to be a nice, well-defined room. Now, if you do not have a consultation room, then I can certainly share with you about how you can, do it in a private operatory. Try to pick one of the biggest private operatories that you have. But those are usually the details I follow in the courses. But today I want to talk to you about presenting the case in relation to your diagnosis time. Let's say you have a patient that comes in and they have a small amount of dentistry that needs to be done, okay? It's our job, it's our obligation to let them know exactly what they need, and we'll go ahead and hopefully get them started on the treatment as soon as possible. Now, in some scenarios, when you look in the patient's mouth, you see that there is a complex amount of dentistry that needs to be done. Now, any good dentist will agree that what we need to do is to examine the patient thoroughly, possibly take some study models, take some x-rays, and thoroughly study their case before we can do a presentation. Now, there is a second reason for that, which is very, very important, and that is we do not want to overwhelm the patient with a complex type of treatment. So if you have a complex type of a treatment, it requires a much higher degree of trust that needs to be established between you and the patient. So by just throwing big numbers and big treatment plans at the patient, it's not a good idea. Now, the scenario may be different if the patient has already seen another dentist for a complex treatment and they already have a fairly good idea of what the cost of the treatment is, what are some of the things that needs to happen, but they're there for a second opinion. Then I recommend that you certainly can provide them all of that information at the same appointment, as long as when you're ready to present the treatment, it is in an organized fashion, and we have a big list that we go through it within our 3-day MBA program that we teach dentists what to do and what not to do during the presentation. Finally, something very, very important that I encourage, especially those dentists who use various dental insurance codes to enter the patient information into the computer, is that do not present treatment to patient by a menu style of presentation, because most patients do not understand it. They tend to pick and choose the treatment, okay? So there's a technique to how you need to present these cases in a way that patients can become emotionally attached to the treatment before you go and dissect exactly what's involved with the treatment. If this is the first time you're joining my channel or you're hearing about me, please look me up on my website at www.dralannazeri. I provide absolutely first-class dental management training because I have been a dentist for the past 30 years, an entrepreneur, an angel investor, and a consultant across the globe. And I hope I can see you at one of my seminars, workshops, or telecoaching programs. Thank you for your attention.